My name is Dr. Michael Corey, and for the past 15 years I've been providing your friends and neighbors here in Orange County with quality care to help them with their chronic conditions. Now, our office is unique in that we will treat you neurologically, we will treat you metabolically, and we will treat you structurally. No other office in this area is doing just that. And that is the key to helping you recover from fibromyalgia. Now, your doctors may have said that, well, it's all in your head. They might have disregarded it. You might be taking antidepressants, taking muscle relaxers, taking painkillers, taking digestive aids, taking sleep aids. Well, I want you to put an end to all of that. Let's get to the bottom of why you're having the fibromyalgia and help you recover so you can lead a healthy and happy life again. Now, there's a couple of different things that we want to discuss with you in this brief video. Fibromyalgia is not just one problem with your muscles. Many of the doctors probably have looked at you and they've evaluated, well, the muscle pain. So they give you the painkillers. They give you muscle relaxants. It's not a muscle problem. Now, the majority of fibromyalgia sufferers actually have a brain-based problem, and a lot of the problems are stemmed from the mesencephalon in the midbrain. So what we want to look at is when we have that overfiring, you're not going to be able to relax, you're not going to be in constant pain, we're going to have insomnia issues. But the web of physiological dysfunction that we're looking at here can kind of, in a short period of time, help you look at that we don't just have one problem. We have a multitude of problems giving you a symptom complex called fibromyalgia. We can have gut issue dysfunction. We're going to evaluate that with you here in the office. We're going to check you for hormone levels. We're going to check your thyroid dysfunction. We're going to check your liver. We're going to come back and look at your immune system. The majority of patients with fibromyalgia are autoimmune. And what that means is that your body's actually attacking its own tissue. There's no way you're going to recover if you're just taking all these medications for this symptom and that symptom. We have to get to the ground floor and build a foundation for your health so that you can recover from this terrible, debilitating disease. Now, the other thing we want to evaluate is we want to look at your blood labs, because many of you have had labs and your doctor says, well, they're all normal, but you still feel sick. Well, let's take a peek at it. We're going to look a little bit closer. We have functional lab values that we use in our office. They're ideal, optimal values. Then we have a wider range out here that are the traditional lab values that you get back on your piece of paper when you go back from your doctor and you get that lab. There's a vast difference between the two, because what we're looking at is we're looking at optimal ranges. We're not just looking at a wide range, which is actually an average of all the people that have had blood drawn at that lab for the past year. Now, who usually gets lab work done? For the most part, is people with symptoms, people with problems. So that's not even an evaluation for a healthy person. We have to look at a healthy person's blood values, which are the optimal values that we're going to evaluate you with here in our office. So there's a big, big difference with that. Let me show you another example how that plays a part. Your thyroid is very, very important because your thyroid regulates a lot of your metabolism. It's a metabolic engine. And what we want to look at is that you actually have thyroid receptors in virtually every cell of your entire body. And what I mean by that is that we have crosstalk between your brain and your thyroid, your digestive system and your thyroid, your liver and your thyroid, your adrenal glands and cortisol levels and your thyroid, your blood sugar levels and your thyroid. So when we look at TSH, which is one of the primary markers that are usually run, and by the way, your doctor is going to probably run TSH and T4. If that's really what the Mayo Clinic's guidelines do, is they look at those two parameters. We're not going to look at two parameters. We're going to look at 10 different parameters to see exactly what's going on with your thyroid. So from a number standpoint, the lab values that your doctor is looking at is 0.3 to 5.7. 0.3 to 5.7, a big wide range. Now our optimal values are 1.8 to 3. So anything from 0.3 to 1.8, your doctor is saying you're within normal limits. There's nothing wrong with you. If we're looking at 3.0 to 5.7, your doctor is saying there's no problem. You're okay. Now, well, the facts are is that if you have a 4.2, you're actually a hypothyroid. You have a decrease in the function of the thyroid. And like I said, the thyroid gland is very, very important, communicating with every cell in your entire body. We can look at your glucose levels. Your functional range is 85 to 100. But your traditional lab values are 65 to 110. they're going to let you slip out there, then they're going to give you a medication. That's the medical model. What we're looking at from a functional medicine standpoint is we're looking at optimal levels. We're looking at upregulating your body to make sure that it's running efficiently and functioning properly so that we can get rid of the underlying condition that you've been diagnosed with. Now, I think this slide basically says it all. You can't poison your way back to health. Now, you might have been prescribed a painkiller, a muscle relaxant, sleep aid, an antidepressant. Maybe your doctor sent you to a psychologist or psychiatrist, and you're on medications. Well, I'm not going to take you off of any medications. That's between your primary healthcare provider in medicine and yourself. He has to take you off if he's put you on it. But what I will do is I will help you uncover and correct the underlying causes of the dysfunction. And then your doctor might be more willing to go ahead and make that change for you. Or you can request it from him and have that discussion. Now, we're going to leave no stone unturned. And what we want to do is we want to understand that your brain has to fire to every muscle, cell, and tissue in your body. And your body's got to send signals back to your brain. Our right side of the brain controls the left side of the body. Left side of the brain controls the right side of the body. And when we have misfiring of the mesencephalon, we're going to have problems, like I said, with insomnia, with pain, with dysfunction, with a variety of different areas of your nervous system. But we're going to also evaluate you from a hormone standpoint. We're going to check the mesencephalon with your midbrain, blood sugar, oxygen. Your body needs two things to survive. It needs fuel and activation. Fuel comes in the source of glucose. It gets into the cells to produce ATP, which is your energy source, and oxygen is the other fuel. Now, if you're not having proper excursion of your rib cage, we can have oxygen deprivation. That rib cage cannot be opening up, not allowing the balloons to open up nice and wide to the lungs and deflate again. So we can have oxygen issues. We're going to take care of that. We have therapies in our office which will take care of that and increase that oxygenation to your tissues. We also can have problems with the cerebellum, going back to the brain misfiring again. Cortisol levels can be off. Now, what's important is that we're not going to go through and use a cookie cutter approach. We're going to treat you individually. We will treat you as a whole person by bringing all those pieces back together at the same time. Now, what's important for you to understand is my goal is to help you find a natural and effective protocol to enhance your body's function so that you can have the best chance possible to live a long and healthy and happy life. That's really what life is about, and it should be enjoyed. And if you're not enjoying yours, we need to delve a little bit deeper, and we need to find out what the cause of your health condition is. And we do that by running specific tests. Now, we're going to run tests that your doctor hasn't even thought about. We're going to leave no stone unturned to make sure we can help you get well. Now, since this is a short video, I do have a DVD that I can send to you. And if you would like to order the DVD, you can order it on the page that you're on. You'll see, click here for your free DVD. You'll register, and we'll get that out to you right away. If you would like to come into our office for a free consultation, I will provide that to you. And all you have to do is call our office directly at 714-730-5833. My name is Dr. Michael Corey, and I want to help you get your life back.